Hello and welcome to Season 3 of Rooted and Reaching, where we talk with dreamers, doers, and difference makers building an innovative future right here in the South Bend Elkhart region. Entrepreneurs know that where we're rooted matters, and where we're reaching matters even more. Today we're talking to Dr. Tod Stillson, who took years of rural healthcare experience in Marshall County to build ChatRx, an innovative AI-driven doctor in your pocket. We are thrilled today to have on Rooted and Reaching Dr. Tod Stillson, the founder and creator of ChatRx, which is, I'm going to read what you just told me a minute ago, the family doctor of the future.
Yes.
Okay, now if that's not intriguing, I don't know what is. So we need some context for the audience. What is ChatRx?
Yeah.
And who are you?
Yeah.
And what is ChatRx?
Yeah. So let's start with your audience that I'm a family doctor from Marshall County, worked as a rural family doctor for 30 years, practicing the full spectrum of family medicine. And so I retired.
You've seen it all.
I've seen it all and been in the trenches, managed 5,000 patients, 24/7 doctor, deliver babies, take care of patients in the hospital, truly lived, ate, drank, slept family medicine in its purest sense. Okay. And
Amazing.
so I am, I retired from that gig about a year ago. Okay. And I knew for a couple of years that I was planning to retire from that and then iterate myself into something a little different. That's what we're going to talk about with ChatRx today.
Right.
The idea of ChatRx has been germinating in my mind for about a decade, but it takes the right time for a startup to begin. There's a whole timing sequence that develops. And for me, that included, though, the idea that I would have time away from a 24/7 job
I imagine.
as a rural doctor. So that was key for me, but that's my background. So what I started was a 24/7 telemedicine company.
I was going to say, you went from a very intense full-time 24/7 job as a practicing doctor to a 24/7 job as an entrepreneur.
That's exactly right. But here's the thing. That's an easy iteration for me because I've done it for 30 years, right? That's not a leap. But here's the difference, and this is what the profound difference of this is, that I built a product that's a telemedicine product that's very niche-based. Okay, we treat 39 common infections, and it's asynchronous. That means that you are not scheduling an appointment to see me.
Right.
I am managing the process through the power of technology, through a 5-minute chat experience for the consumer to get their common conditions treated rapidly.
Yeah.
This is not full spectrum family medicine like I did for 30 years, a very focused niche area.
Right. Which is critical for an entrepreneur, right?
Yes,
you
it
start narrow
and go deep.
Where you're good and go deep. So good. I want to ask many more questions about that. But again, give us the high level overview. What is ChatRx?
So
what does it do? How does it?
Yeah, so ChatRx is a SaaS product that is based upon a software as a medical device that's FDA approved that I created and invented over the past year that powers an experience for a patient to use our free symptom checker from anywhere in the world to determine if they have one of the 39 conditions that we treat. It's a triage system, that's based on chat and history only. No examination, no video, no appointments. In that experience, do you want me to pause?
Well, walk me through what that would look like for a user.
And before I do that, I'll just tell you there's 3 phases. Symptom check.
Got it.
Medical environment, where we actually grab some medical data from you to allow a prescription to be generated if you have a qualified condition, and then that gets sent to the pharmacy. So those are the 3 steps. If you have check symptoms, medical information, send a prescription to the pharmacy. Okay, so now we'll come back to the beginning of the symptom checker idea. So a symptom checker is really not an audio-visual based experience that people are most used to nowadays in telemedicine. So telemedicine, you make an appointment with the telemedicine company, or even your local doctor can do telemedicine visits. But it requires high-level technology. If you've ever done teleconferences from anywhere in the world, sometimes the internet doesn't work well for you because it doesn't have the bandwidth to do that. So we're taking a concept of sort of a visit and moving it out of the audiovisual arena and moving it to the chat-based arena.
Which folks are familiar with.
They're very familiar with, especially your Gen Zers out there who love this. And the reality is, though, that I know from having practiced medicine for as long as I have that most of these common conditions are history-based. I know when I walk into an exam room, based upon your history, that you likely have a condition just by history. And the examination that I do or any lab testing that's associated is purely kind of cursory, sort of like just confirming the diagnosis, okay? And so it doesn't require a high level of sophistication to determine common infections. Now, it certainly still, though, does require an algorithm, right? So this is not we're not talking about a company that has an antibiotic vending machine. That's not the goal here. The goal is to help you use AI through an AI agent that I've trained from a proprietary standpoint to walk through a series of chat questions that literally in a couple minutes will help you determine if you have a condition that we can treat. We call that our qualified conditions.
Right. And you mentioned there were 39 of those.
There's 39 of those conditions that ranges from UTIs to bronchitis to sinus infection to pink eye to STIs, that sexually transmitted infections. You really name the long spectrum of them.
So I want to ask how you determine those 39 qualified conditions, but before I do so, I want to walk one more time through this. So I'm on a chat, I log in and I say doctor. Well, they're not an actual doctor there, but the chat bot.
My avatar is Dr. Tod.
Your avatar is there, and it has been trained based on your years of experience.
That's correct.
And I type in, I've got a fever, I've got a headache, and then the chat bot asks some follow-up questions.
You're going to get like really dialogue, just like you were texting me as a friend and family member.
Right.
So I built this because here, guess what? I also know this part, that people have trouble getting into the doctor, into the clinic, even my own clinic back in the past 30 years when you're sick. And so what I learned and experienced over the years were patients will find a way to get a hold of you. And what they do is they chat, right? They send you a text message. Hey, doc, I tried to get in today. I couldn't. They can't see me for 3 days.
Right.
I got something simple. Can you just take care of this, right?
Right.
This is and I'll ask them a couple of questions. Hey, is your throat sore?
Easy to
red?
imagine. Yeah.
Da-da-da-da. In 3 questions, I've got it figured out. Let me send the script in for you. That's the old friends and family network, but there's a lot of risk and liability for it. It's not a good process for the patient or the doctor. But it's a reality about how it works in the real world, okay? So now let's formalize that idea into this experience that I'm talking about that allows us to really make sure the diagnosis is accurate and correct through your symptoms. So literally for the consumer or user, they're going to feel like they're chatting with me. They provide me the information. I send them back some questions, and we go through this whole back and forth process.
Yeah. So how is the risk mitigated there? Because it sounds a lot like that friends and family thing where they're texting you, but you said there was a lot of risk involved in that, or liability.
The risks are mitigated in the following way. We have 4 categories that every one of these experiences will fit into. A qualified condition, which is one of the 39 conditions we treat.
Got it.
A non-qualified condition, which is generically something that's not in our space. We don't treat that, so we're going to recommend you see a teledoctor that's more broad than us.
Okay.
A clinic, an urgent care, your primary care, an ER, okay? Number 3, we have high-risk conditions that require emergent attention. We are going to identify those and say, you need to see somebody immediately in one of those environments.
So if I'm having a heart attack and I'm describing to the chat bot that I have these symptoms that are very clearly aligned with a heart attack, you're going to tell me.
Yeah, we'll stop the chat right there and say, you need to go to the emergency room for this condition.
Got it. Okay.
And then number 4, we have viral conditions that don't need medications, okay? And so we're not going to try and prescribe you medicine for a virus.
For example,
a viral gastroenteritis when you're throwing up and have diarrhea.
Okay.
That'd be a good classic example. We've all probably had those where you last 24 or 36 hours, you feel crummy, you're not quite sure, what to do about it. We'll provide the kind of outpatient or home-based remedies for that. But here's the other feature that we have in our product that's based on 30 years of experience. For those particular issues, among the other conditions that we treat, we're providing a note for work or school. Because here's the reality for you. If you're sick with a stomach virus and you know, it's not like rocket science. I know I've got a stomach virus, but you miss work. And guess what? Many of the workplaces require nowadays if somebody misses work.
Some kind of a note
from a doctor that says you were really sick.
Okay.
And what do you have to do as a consumer? You're like, oh, crud, I got to get into the doctor today or tomorrow, miss another day of work, go to the doctor and say, doctor, I've got a virus. I'm feeling a little better today. I just need a note for work. And you got to pay $150 for that?
Right. So
That's
in this
stupidity,
case, in this category 4, there's no medicine needs to be
but
prescribed, but there is this
Now for those other 39 conditions, we provide notes too. That's all part of our rodeo with that as well. But that's a space that the average consumer often finds himself in that predicament of what do I do about the virus when I have to get a note. So those are our 4 spaces, but they're very risk averse. So we know what we treat, how we get to those diagnoses. And then if it's not in those boxes, we're going to send you somewhere else to get that treatment. Okay. And now I do want to come back to a question that comes up along those lines. Doctors ask me this all the time when I talk about my product, but even the average consumer will, well, what's the accuracy rate? How safe is this, right?
Yep.
So I'm going to tell you some data that was done in the last year that shows, talks about the accuracy of doctors versus the accuracy of AI for making diagnoses. Average family doctors, apples to apples, comparing AI to family doctors, family doc gets about 75 to 80% of the time they get it right.
Okay.
Pretty good.
Pretty
that's
good.
about what you expect, not 100%.
Yeah.
AI gets about 90% effective. Okay.
Based on the same inputs.
Yep, based on the same inputs.
Yeah.
Interestingly enough, doctor plus AI make AI available to them. They still score around 75 to 80% because doctors are a little resistant to letting AI help them. Okay.
Yeah. They're like, oh, no, I know better or something.
I got
right.
this. Okay. They don't trust it totally. Now, if you take our system, we're looking at a 90 to 95%. That's our stated goal, and that's what we've created our symptom checker to be in those 39 diagnoses. 90 to 95% accurate.
Yep.
The average listener may go, why don't you shoot for 100%? Well, it'd be great to be 100%, but you're dealing with humans. It's never going to be 100%, okay?
Right.
But we're talking about a high accuracy rate when it comes to the symptom checker. And that's what we document. That's what we perform.
Yeah, certainly above average, right?
Definitely above average.
So, okay, I'm wanting to ask this. It is a lot. No, that's all fantastic. And that's a really interesting evidence there.
Yeah.
I think all of us who have been to the doctor recently and who have used ChatGPT or another 100%. AI to see how we're feeling. My son did this the other day. He's 15. Shoulder was hurting. He was typing into ChatGPT. What's wrong with my shoulder? So the 39... What do you call them? 39 diagnoses. Where did those come from?
So those came from Dr. Tod Stillson because I've done this long enough to know what the common, easily identifiable by history problems are that patients get on a regular basis that they need treatment for. I know them because I've lived this life for 30 years. Okay.
So this is roughly for 30 years, these are 39
the
symptoms.
I see. I call them
80% of the time, or some high percentage.
So you're dealing with entrepreneurs, not the regular the consumer listening to this, probably, right? So listen, in medicine we call these easy visits.
Okay.
In medicine we call these cherry picking visits. Okay, because they're so easy. Compared to the complexity of what we deal with patients all day long. We love seeing some of these patients on our schedule because they're easy peasy, right? You don't have to use many brain cells to figure it out, right?
Sure.
And I spend most of my time in those visits talking about their kids and their family and how life's going than I do about the diagnoses because they're that easy. Now take a family doctor or any doctor who's busy. Like they're all crunching. They're all working, hoofing it as hard as they can. And then you have the patient call in and say, I've got a yeast infection. Okay, I need a woman call. I have a yeast infection. Can you get me in so I get checked and confirm it and get treated? That's what the standard of care is to do.
Yep.
And you go, I can't get him in. I'm booked. 4th of July is coming on Friday.
Right.
I can't get, what am I going to do? And you feel bad. As a doctor, you feel bad.
Because you know it's probably true, right? And you know that what they need is that.
Bingo. And so you're faced with this dilemma. Do I work them in? Or B, do I just kind of don't even ask any questions? Here, send in a medicine for them because I'm just going to make it easy, okay? Or better, can you have a system like we have where it's really more of an automated consumer-directed system that makes sure they have what they need and get the proper treatment, okay? All for free.
Yep.
Okay?
All for free.
All for free.
Yeah, so questions about that as well. Yeah. But I wanted to back up. So you said you've had this idea about 10 years. AI wasn't really on the scene 10 years ago. So was this an opportunity, a right time, right place kind of moment?
Huge opportunity, right time, right place. So the stars aligned in the following way. Direct-to-consumer healthcare has come on the scene in the last 5 years. We see the Hims and Hers and Rose and all the other obesity medicine places that are, everybody's marketing directly to the consumer and taking the insurances to a large extent out of that equation. We see direct primary care emerging in a lot of communities, okay? So again, removing the insurance out of the equation. My product removes the insurance out of the equation. It flattens it just to me and you. Me and you, that's it. Yeah. Okay. Number two, COVID brought in telemedicine. So COVID accelerated the adoption of telemedicine that now has become an acceptable, normal standard in the stack of what healthcare options that consumers kind of consider reasonable.
Yeah, sure. I'm sure consumers became much more comfortable with that idea because that was the only option we had for a while.
AI technology came in on top of that now in the last few years to allow us to really accelerate how the knowledge industry, like I have in medicine, can now be scaled up to be applied to everyone everywhere. Yeah. Okay. Yeah. And so you take all of those things together, and that provides the right environment for it. Now, back 10 years ago, in a medical clinic like mine, that, as you can imagine, was very, very busy. To manage the very, very busyness of it, I created what's called standing orders. That's so all of my staff knew if X happened, do Y. Okay. I'll always approve Y. I'll always sign off on Y. Okay. You don't need to ask me. You just do Y. Okay. Those are called standing orders. Okay. And so we create this hardwired scripting.
So you had created a very early paper-based version of...
And doctors all over the country know that hack that I just said and do it all the time when they're clinics and with their staff usually. If they're smart, they do because it makes life a lot better. Yeah. That hack was going on. Now, what happened was we had a influenza epidemic outbreak hit the community. So now... Managing 5,000 patients, our phone log is jammed with people. I'm sick. I got cough. I achy all over. And we have no place to see these people. Right. The ER, the urgent care was gummed up with all of it as well, right? Yeah. And so what I did was I created a history-based for my staff. If the patient has this, and this, they've got influenza.
Based on a phone conversation.
Based on a phone conversation, based upon a phone conversation and history alone. Yeah. And I would say, that means you have influenza. We're going to just send the script into the pharmacy for you. No need to come in. No need to do anything else. We've got you. Right. Okay. Right. Well, that definitely got the wheels turning in my brain like, this is really cool. It could work in this emergency situation. Yeah. This might be replicatable for other things in the future. Now, all those conversions of things I mentioned happened, including the fourth one, which is now I had time retiring to be able to put my mind and brain into it. Yeah.
So that makes sense. It seems like there was a fairly big leap there in terms of the technology piece of it, though. Yes. You were going from paper and phone calls to AI. How did you do that? Like, where did the expertise come from to adopt that?
I've always been an early adopter, number one. I have no fear of early adoption. And number two, I've always been just a confident person and thankfully have some intelligence that allows me to just say, you know what? I'm going to develop the prototype for this. Yeah. Okay, why not? The tech is here. So what I did was I orchestrated in my mind, developed a workflow for what it would look like to create this. Okay. I went and identified a developer who would develop the prototype for me. Okay. Is this possible? Yep. We forged the development. We created the prototype. Yep. The prototype was like, yeah, this is doable. And as soon as I knew that was doable,
Okay.
then all of a sudden I'm off to the races with that whole process of really starting a business, moving it from the idea into the MVP stage, which is just where we're at today, a year later.
Yep.
Now assembled, 10 plus people around me working as hard as they can for us to take care of patients in the market. Okay.
I am curious about your team too. Yeah. Before we get to the team though, so once you realized it was possible, so you were working with a developer and it needed to be trained.
Yeah.
I think a lot of us hear about training AI, but I don't know that many of us know what does that entail. Yeah. In my mind, I'm imagining you talking to it or taking 30 years worth of doctor's notes, scanning them all and dropping them into...
This is a great question, and here's the deal. So there's sort of a corner in the market for AI with several companies out there. You talk about Alphabet, you talk about Microsoft, OpenAI, and then the Chinese company. There's a few, there's some bigger players out here. And this has been a big learning curve for me this past year, right? Because AI is just not a generic term, all right? So I had to identify which of those companies that I believe was best suited for my medical case use. Turns out OpenAI is the best company for that medical case use. They sort of list in that direction in terms of their LLM stack, okay?
Right.
And
language learning model.
Very good out of the box, so to speak.
Yeah.
Okay.
That's Claude, right? I think
Claude
OpenAI
uses OpenAI, but Claude is even a more sophisticated version of that, a more humanized version of it. We chose to take more of the generic OpenAI. So Claude, again, if you think of Claude's like OpenAI made into a more humanized form, it's easier sort of interface, if you will, for people.
But in the background, the OpenAI technology is working, and that's the same
infrastructure. It's like the electric company, so to speak. It all gets poured in there.
Got it. So and that's the same one that you chose.
Yeah, so we chose OpenAI and then begin to train that OpenAI in a proprietary way with the specific diagnoses. You work your way backwards. What are the symptoms? And so I have long, big documents that you train in vector files with what are the symptoms, what are the diagnoses, and what are the problems that all create and land a person into a particular condition, like pink eye. Yeah. Pink eye would be a great example, right? What are the finite symptoms that you get when you have pink eye? Well, they're finite. They're there, but red eyes, goopsy stuff in your eye. Yeah, I mean, it's not a super complex list, but it's a list nonetheless.
Right. There is a list of known identifiable
and
symptoms.
You begin training your AI agent with that. Then what you do is you have what's called a RAG model. Okay, a RAG model is sort of like, think of it like is Dr. Stillson's brain.
Okay.
And this is my brain. It has to do with not only making the diagnosis, but when you move into the second stage of our product, it is choosing the medicine. What's the first rank order of medicines that I would choose for somebody? What are the doses of those medicines? Right. What's the dosing for the person's medical conditions? How do you figure out their allergies? What's their weight? Which pharmacy do they want to use? All of that knowledge is put into what's called a RAG form. Okay. So our OpenAI then takes the information of the diagnoses that's proprietary, created specifically for us, and then runs it through that RAG system and brings it back around to apply it to the consumer. Okay, and again, that's proprietary.
So does that RAG system require, is this the step where you're gathering additional information? Like, give me your age, your weight, your...
The consumer feels like they're just giving us additional medical information. But for me, I'm building the stack of the data on them that I'm able to apply to that RAG system.
Got it.
That pulls it even further through in a very specific way.
Yeah.
We've got a whole big health stack on this, okay? A big health stack to make all this happen.
What do you mean? What do you mean by that? What's a big health stack?
A health stack is all of the APIs that are stacked on top of one another to make all the things I just described happen magically, okay? It's not just OpenAI doing that. There's a lot of APIs that are used to stack together to make that work. As an example, I'm going to tell you the tail end. We partnered with a pharmaceutical company called Axe Pharmaceuticals that's kind of like GoodRx, okay? You think about at the end, I'm going to help the consumer choose the right medicine. I'm giving them a choice, by the way, of 2 medicines to choose from. So, and I'm also providing to them the price point, the cash-based price point for that prescription at the pharmacy they choose.
That is helpful.
Okay. And it includes a coupon system for free. So they get to choose the medicine.
Yeah.
They also get to choose the price point in the medicine.
Yeah.
And we have that all architected into the system so that we make sure for a consumer, it feels like you're getting the least expensive experience possible to get your condition treated. Okay. All that's just the magic of it. And for consumers, I don't want to bore them with all the details of what it takes to stack that up. Yeah. But we've chosen, as an example, again, a consumer doesn't pay till the end. They get to the end. They choose their medicine. By the way, the medicine's not inclusive in the price. They're going to pay that at the pharmacy.
Yeah.
But then they just pay $20 for the experience or $10 for a note if they need a note as well.
Yep.
And hit the pay button and magic.
Okay. Well, yeah. So you got to that because I was wondering how does, you're cutting the insurance company
out. They're not involved.
In this case.
They are not involved.
But you also need to make money.
Yeah. So great question. So let me pause right there and say, it's a business. It needs to make money.
Yes.
But Marty, here's the deal. I've had a great life as a doctor. I've loved what I've done.
That's great.
I'm financially secure.
Yeah.
I created this product in mind with do good. Do what's best for people.
I've seen that in things you've written about it.
It is a truth about me and why this company exists. It is not to make $1 gazillion from people.
Sure.
Okay? And it's a great idea. I know it's a great idea. And it could make $1 gazillion, but that's not why I'm doing this.
Yeah.
I'm doing this to get consumers and the real people of the world what they need when they need it.
I am sure they're grateful for that because so many of us feel like we're paying huge portions of our income towards healthcare. It is a real burden for a lot of families.
So what I'm doing with this product, I'm not adding to that burden. I'm actually lowering the burden.
Right.
The cost to the consumer to get that healthcare is going to go down.
Is it like you have to be behind it though, right? An actual doctor.
That is correct.
Has to sign off on it.
And that's the power of me being the founder.
Yes.
Is that I have a medical license. And so that brings me to like our launch point as an example. We started what we call in the Stillson bubble of local Plymouth, with people that are very tied to me, that are interested in it.
Sure.
But we're expanding pretty quickly in the next few months to Michigan, Indiana, Illinois, broadly, those states that I have licenses in.
I see. Okay.
Chicago, Detroit, Indianapolis, big markets that will descend and begin to market to them and the consumers in those markets.
Yeah.
But then our goal is to go national. So I already have like 12 additional licenses for the Midwest and the Plain States because that's going to be our continued march of growth.
What do you mean you have additional licenses? Like you've brought folks on staff,
no.
or you have them yourself?
I have them myself. So I have 15 states medical licenses.
Got it.
So I can provide care. That's an FTC rule. I have to have a license to provide care in those. But I'm it. I'm the only guy doing this. So that's why this is another profound part of this. Asynchronous care allows me to provide care simultaneously to thousands of patients. Thousands.
Yeah.
In my old clinic, I had to see patients every 15 minutes. There's a finite schedule. I could fit in 35, 40 patients a day to do that.
Right.
In this model, I can see thousands simultaneously in an asynchronous manner.
Yeah. And there's no so thousands are going through. Do you, the system, you trust it enough
100%. It's hard.
You don't need to go in and review.
No, but we will review them. So let's come back then to. So the system's so hardwired that the safety and quality I know is right. Okay.
Yeah.
Greater than 90% accuracy with the diagnosis. We're not going to be an antibiotic vending machine. I know the right medicine, right dose is going to get chosen. However, it's a continuous auditing process that you have to do. So every day there's an auditing process that we work through as a team to make sure that all of those metrics are being followed and
Yeah.
are accurate, that there's no deviation to that. So it's a continuous process, just
Yeah.
like any business has a continuous process of improvement in quality.
Yeah. Is there a feedback loop from the consumer?
Yes, absolutely. There's a feedback
So
loop.
like,
And so,
I can get better, or
yeah. So I have a chief marketing officer. That's his whole gig. Okay. And
Got it.
he'll eventually, he's a fractional chief marketing officer, eventually evolve into our chief customer success person, probably.
Great.
All of that feedback loop is critical to the success of a SaaS company.
Yeah.
This product is not about me. It's not about ChatRx per se. In my mind, it's about the consumer. It is one of our value statements: patients and consumers first, okay? And we're building this and seeking their feedback so that it's always best for them.
Yeah. That's great. I'm going to challenge you for half a second on that, though, because you say it's not about you, and yet it feels like the entire thing hinges on you.
Well, it does right now. In a reality, I am like any founder.
Yeah.
I am very much at the heart of it, right? Okay.
Yeah.
And so it couldn't be done
But
without me.
your license is at the heart of it as well,
true.
right?
That is exactly right.
The fact that you are a licensed medical doctor in X number of states.
So we're talking about the direct to consumer version of this, and that's where we begin the journey, direct to consumer. I will tell you, Marty, that the biggest opportunity is the enterprise model. Okay, the bigger opportunity is entering into the medical side and partnering with hospitals, medical clinics, insurance companies, et cetera, where we have an API that allows that was in the driver's seat for the direct-to-consumer version now is replaced by the doctor in each one of those environments. And they sort of get that same role that I've had, but we have the API version, white label version, all sorts of partnership versions that allow us to take this and massively send it out to people all
So
over.
a healthcare system in Boise, Idaho could adopt the technology, white label
it, put their doctors in the driver's seat, develop the software to support that, and make that happen. And then that doctor is sort of doing what I'm doing and getting the magic of it themselves. Okay. And at the end of the day, that's a consumer-oriented version of that. So the doctor in Boise, in the medical facility in Boise, had the same issue that exists everywhere in the country right now: access to care. Study just came out. It's the average appointment time for a family doctor, 14 days. In some urban areas, it's as much as 60 days.
Okay, to get an appointment.
Yep, to get an appointment.
Yeah.
Just to get an appointment. In some urban areas, it's as low as 6 to 9 days. In the rural areas, it's higher than you might expect. Okay, it's like more than 14 days oftentimes. All right. Yeah. So guess what? These common infections that I'm talking about, do you predict you're going to get those? Do you know ahead of time? I'm going to schedule that appointment in 2 weeks so that when I get sick, I've got it.
This is why everybody runs to the urgent care office.
Yeah. So why not save the consumer the hassle and money by giving them a free symptom checker system that allows them to have no cost, find out if they need treatment, and if they have a common problem that's easily treatable. Well,
that does seem like the magic of it. You have these two outputs that are really valuable: a prescription for something simple that you need, and a doctor's note. Right.
Yeah, and every health system in the world, but especially in the U.S., need this because they all deal with access issues. So this triage system and the magic of scaling up the doctor to do things asynchronously, powerful idea. I'm telling you, Marty.
It is a powerful idea. And, I before I dig too deep into the weeds on this specific product, ChatRx, what is the bigger picture looking like to you right now? I mean, you're a year into this. You're seeing AI transform medicine, I'm sure.
So as an entrepreneur, I'll tell you, I'll put my entrepreneur hat here on. I think the life of our business, it could be variable, but I anticipate a merger acquisition of us by somebody bigger than us, probably in 3 years or so. I don't know. It could be 2 years, 3 years, 4 years. I could do this for a long time. I love it. Okay. And so, and then when you think about mergers, acquisitions and all that sort of business, I mean, part of it could be I sell the company and my shares to somebody, but I stay on board in the doctor chair.
Sure.
And so I have this orchestrated and built in a way that I can play different roles, founder, owner, or I can play the medical role, chief medical officer in that
Yeah.
business, or just be an independent contractor, medical provider sitting in that
who
chair.
is sitting in the
providing
doctor chair doing
I
it.
can do all of those things.
So you see this coming because you're seeing the industry changing,
Yep.
I'm assuming.
100%.
So what changes are you seeing
Yeah.
such that you think that ChatRx could be ended
Well,
up
the big
a merger or acquisition in a couple of years?
There's a couple big system things that are going on. Access
Yeah.
to care, I said, is a huge problem. Every medical clinic, not only consumers, but medical providers, institutionally, corporately have what do we do and how do we manage that? How do we recruit and retrain doctors and nurse practitioners and PAs? So the answer in the system is go hire PAs and NPs. That's what you're seeing. The average consumer listening to this go, yeah, I've seen an NP, I've seen a PA like that. I can see that they're coming on, they're cheaper labor, they can do some of this work.
Right.
But guess what? AI solutions are also part of that ribbon. Okay.
Mm-hmm.
And so our company's positioning itself in the medical space to be one of the AI solutions to providers of care in that space. So that's one. Number two, healthcare costs you mentioned are accelerating and growing. Our GDP, it's nearing 20% of our GDP. And the data doesn't show it's going to go down. The data shows it's only going to go up. And so if we can take a product that allows in the system for the experience of getting a bronchitis treated on a claim side of an insurance company, it costs them $150, okay, for a consumer to go in, see the doctor, go get their prescription. The whole throughput is actually $150 to $180, okay?
Sure. Okay.
So
to get the care you need to treat the symptom.
Just for that common condition. Leave that in your brain and then take our product and go, okay, going to cost $20 plus the $4 amoxicillin prescription at the pharmacy. So you went from $150 to $180. Now to $24. Having the same condition treated. Okay. Not only is that convenient for consumers, not only does it cost them less money, make it more affordable, but the people who are used to paying for it, the system, the corporations, the insurances, they're also going to see that number come down dramatically. So are we contributing to increasing the cost of healthcare? No. We're creating a solution that actually lowers the cost of healthcare.
Right.
Okay.
Well, and I imagine for a lot of clinics, it would be an advantage to keep those easy patients out of the office so that you could focus on
more complicated
cases.
Time to take care of. Right. Exactly. So after doctors, just to tell you, not every doctor embraces this as this is wonderful. Some of them will see it as competition, right?
Yeah.
And some of them
I'm thinking about the insurance companies may not like this either, right?
This is how, again, a primary care doctor, I've done this long enough, I know. I've trained family doctors all of my career, all the time. I mean, I've done this. They're going to see a PA, an NP, and an AI as competition. And they're going to see it as competition for their easy visits. So if I stack you with 30 hard visits a day, and they're all hard, you're going to go, golly, that leads to burnout. Give me a few earaches and a few UTIs.
Right. I can just write an antibiotic script
I'm done, okay? Like they need those sort of sprinkled in there for their just, health, well-being, all right? And so they get a little bit perturbed and they're like, well, of course they can't get in to see me because I'm so busy with all these crazy, hard patients, right? So then the NPs and PAs in the office, they get to see the UTIs and the bronchitises, and they're like, easy peasy visits for them. I'm over here working like a dog, and that NP or PA, who's the access valve, is they get a little like, this isn't great because I'm working harder and they're not working as hard. This is human nature. This is how it works, okay?
No, you can see it.
And so now you take an AI product. So to make this work for the doctor, to make this really work for the doctor, here's what we have to do. We have to do a profit sharing component with it, okay? So in other words, if I say to the doctor, add in ChatRx to triage out and treat these common infections so they don't even get into your clinic, and we'll share a little bit of that profit then they're going to go, oh,
then they're incentivized.
now I have some incentive for that, almost like an affiliate relationship, right? You think about it in a simple marketing way.
Right.
But if we share that together, they win, we win, everybody wins, patient, doctor, and ChatRx.
Yeah.
There's ways to do this, and it takes somebody who's been where I have been for 30 years to know and understand all of those nuances.
Yeah. So you've been a rural physician for 30 years.
Yes.
Do you think that experience taught you something that maybe being part of a bigger healthcare system wouldn't have, that has helped you understand the needs and made this a better product?
So I would back up a little bit and say, number one, I grew up in Bremen in Marshall County. Small town guy, first to go to college in the family, blew up in a blue collar factory working family.
Okay.
I've always viewed medicine through those eyes of real people, regular people who work hard every day, and they need access to care, and they need somebody to love on them and take care of them with quality care. Yeah. So I've run a clinic. I don't care whether it's rural or if I would have been in South Bend, I'd run it the same way through those eyes, okay? And so when I created this product, I created it still through those eyes of that, yes, rural people have it harder. You know, we look at people in South Bend, Mishawaka and say, you've got plenty of doctors around here. As an example, I gave my system that I had worked for in my clinic 2 years notice. Hey, go find a doctor to replace me.
That you were going to retire.
I'm going to retire. Go find a doctor to replace me. Here we are now, 3 years later.
Okay.
Have they found a doctor to replace me? No, they haven't, because they can't. Recruitment and retention of doctors in rural areas is a huge problem, growing gap, huge issue. It's not because they didn't try to replace me. It's because they couldn't identify people that want to come to rural areas.
Right. You have to convince a doctor to move to Bremen.
The gap is growing. And so my heart and burden are for the disadvantaged, and I consider rural people some of the disadvantaged in our country that can't get timely access to care when they need it. And so again, that's the part of the inspiration for me. Friends and Family Network, I can help you. I've got the knowledge. I can create the right system and make myself and our care for you accessible to the average person. Okay.
I'm aware that rural healthcare systems are struggling, right? The
horrible.
Recruitment, the retention of quality
all over the
personnel.
country.
Small rural hospitals.
Access to care becoming
struggling to keep the doors open.
It's a sad state.
Is this going to help or hurt, though?
This is going to help.
From a healthcare system perspective, like if you're a small rural hospital,
if I'm a small rural hospital, or clinic, this is going to help because I'm not going to clog up your ER and urgent care environments with simple things. Yeah, it's a truly off-putting of things that are simply and easily treatable that are not going to clog those.
Do you imagine running a rural clinic more efficiently with fewer staff?
Oh, definitely you could. Now, you could do that to some extent, but, medicine is so regulated and corporatized, and there's a lot of things associated with the chronic disease management and wellness and all that sort of stuff. This is just a small piece of it, so it's not going to dramatically move that bar of all the stuff we just talked about.
Gotcha.
It's still a lot of work. You're not going to probably reduce your staff, but what you're going to do is you're going to help take care of patients. Who are trying to get in to see you when they call and say it's going to be 14 days when you have your UTI.
Right. I mean, that is kind of crazy, right?
It's stupid.
What happens if it's a child?
So we take care of pediatric patients.
You do. So like if a mom is writing, hey, my 5-year-old is running a fever and has a runny nose, so
Great question. So I've done family medicine for so long and I deliver babies, take care of moms and families. I take the whole spectrum of the family. We created this product so that the primary user, it creates an account in our system as a user, but we allow for the addition of dependents. And we have 2 types of dependents in our system: minors, those 18 and under, and adult dependents. So and a great example we see all the time in medicine is I'm taking care of my mom who is housebound, who can't get into the clinic very easily. And certainly when I try and get her in for that infection, it's a huge event.
Gets frequent UTIs.
Yeah, it's just and so we've created our system to account for
that's great.
People being added in that way. And then so you can get on the system as the user, do the symptom checker on behalf of the dependent, and voila, your 4-year-old gets treated for their ear infection. at 3 a.m.
So, yeah, which I'm sure many, many parents are
happens.
grateful for. Yes. Yeah. So obviously you understand the medical profession. You understand negotiating with insurance companies. This sort of,
That's not even a part of this.
right. That's not even part of this. I'm leading to a question here. What surprised you, or what new learnings did you have to absorb to get this thing FDA approved?
Okay,
as a piece of technology.
That's been a big learning curve as well. So let me back up and say I went to pharmacy school before medical school.
Okay.
So I have some awareness of the FDA and drugs and medicines and all that business. But the FDA is very interesting nuance to this. There's you had to learn that there's 3 different types of FDA-approved medical devices. Okay, and we're approved for the level 1 device and not the level 2 and 3, which require a lot more of pre-market data. Okay. So it's a level 1. We didn't require pre-market data to be loaded up to them to get approved.
Is there greater access with level 1, level 2, level 3, or is it
more easily approvable? Okay. All right.
Okay.
Now back up a second and say the FDA has been overwhelmed with AI-driven medical devices. So this we got in early. Okay. And that was to our advantage.
Yeah, I'm sure it was.
And so now they're just so overwhelmed by it. It's hard for them to even manage and figure out. And there's a whole system going on with this. Number 2, what I've this is part of my family doctor wisdom. Family doctors know what they know and know what they don't know. And what they don't know, they ask for help from people, i.e. specialists to help them. Right? FDA approval, do I know that? Shoot, no.
I assume that
I went and hired a law firm.
You found an expert,
I found an expert who does this on AI technology alone.
Great.
And had them work with me to submit the application.
Got it.
And so is there sort of a black box magic to that a little bit? I would say, yeah, but that's because they have the experience to know how to answer the questions in the application the right way.
Well, and it allows you to spend your time where you're the expert.
Yep. So, I mean, there was a lot of things I'd explained to them so they could put it in the application, and there's a lot of blah, blah, blahs. But at the end of the day, I outsourced that to somebody who was an expert.
Yeah. You mentioned the FDA being overwhelmed right now, and I do feel like every time you read the news, there's another idea for an AI-powered product that's going to solve problem X.
Yep.
What's the competition look like right now?
So when it comes to this particular product for us, let me just say what we're doing is a full stack asynchronous telehealth experience to treat these infections. Yeah. We are one of a kind. There is none other on the marketplace right now. Okay. Now, telemedicine businesses that are providing asynchronous care, that is in the marketplace. There are big companies, think of Amazon One Health as an example.
Yeah.
Okay. And other bigger players that are doing asynchronous telehealth medical care. But the trick to those products are you still need an appointment with a medical doctor, a PA, or an NP.
Okay.
It's appointment based. So even if it's asynchronous, meaning what they do is they ask you your symptoms, you fill out sort of a questionnaire, ask you some symptoms. Some of them are AI based, some of them are the old style of point and clicking.
Right. Okay.
But essentially, they assemble the diagnosis on a platter for the PA, NP, or doctor.
Okay.
Who, when they have time,
review it,
and will answer them and say, could be in the best case scenario 6 hours, and in worst case scenario 24 to 36 hours later. But you're left waiting for that appointment based upon that asynchronous data you've given to us. Because of the power of technology, we have totally flattened that so that it feels like you're talking to me in real time.
Yeah.
You're getting your answer in real time, and you're getting your treatment within 5 minutes.
Right.
Totally asynchronous, okay? Now, for those who are skeptics out there, you're going to say, wait a second. Is AI doing all of this for you? Are we talking about an AI doctor, which, by the way, is a whole thing that's a debate out there right now is, because you can, the technology is evolving to the point is, will there ever be a point where there's AI doctors who are licensed by states to do some of this sort of low-hanging fruit work and that are non-human, right? Okay, like avatars.
Yeah, sure. I mean,
future world, but it may be 5 to 10 years from now.
Yeah.
And so, but that's not what's happening. What's happening here is, much like I described, my AI is sort of loading it onto a plate for me.
Yeah.
My system is automated to interpret that plate and then automate the system that I still have to sign off on. I still have to review the chart, sign off on it, say it was okay, say it was legit, and that happens.
Yeah. So for every single case you do, there is a step there where you have to review it?
From a medical record standpoint, I review it and I sign off on it.
Okay.
Okay.
But at that point, it's already
done. Like
it's already done.
The consumer's already picked their amoxicillin up at the pharmacy, but I've had to review it because it's my license, it's my liability, so to speak, and my responsibility to do that.
Sure.
So we haven't created an AI device that is acting like an AI doctor. We've created an AI device that loads it up for me to make the decision.
It cues it up to the point where it's literally just
Yeah, it's an important nuance of why it's a class 1 device, not a class 2 or 3 device on the FDA topic. That's why it's that way.
Here's what I'm looking forward to is the Star Trek future where once a year I just lay down on a table, I get a full body scan.
I forget the name of that little device they had in Star Trek, but it was a thing.
It says like, here's are some things we see or don't see. You're good to go.
I would say this is the prototype version of that to some extent. Okay. But, and we're going to be able to build on this and grow, and there'll be other companies that take the same idea and move it forward and just iterate on it. But we're choosing a low risk, low hanging fruit, easy space for us to take advantage of what technology exists now and really eventually help the consumer. Yeah.
Well, certainly I'm seeing a lot of wisdom in your choice to narrow it down to these 39 common diseases or
conditions.
Conditions. Thank you. I know disease isn't quite right. Conditions, diagnosis, right?
Yeah.
So, which is great because a lot of times you talk to entrepreneurs and they they're thinking too broadly at the beginning instead of really focusing on a segment of the market that needs the care and attention.
It's critical for us in terms of our success is to stay focused in that way in a narrow space, and then again have it answer marketplace. Be a solution to marketplace problems, right? And connect those dots to it. And that's the choice that we're making. Now, I will say my chief marketing officer will be really mad at me if I don't go ChatRx.md. ChatRx.md is our website.
That's the website.
Yeah. And so if you're wondering, what are all those 39 conditions? Go to the website, and we've got it right at the top banner.
Okay, they're right there.
What conditions are treated? We have them all listed there. And hey, give it a whirl.
And this is active right now.
It's active right now. We're in what we call our public preview state, which for a SaaS company just means that we're making it exposed to the public so they can give us the feedback to improve it. We recognize it's not exactly right. And so we're getting that feedback and getting that improvement from them. And after we get that, within about 2 to 3 months, our goal is then to take it to the broader market and then expand it nationally. Okay.
Is part of what's next for you a higher level of FDA approval, or are you're good at the level 1 approval? You can do what you need to do.
We can do everything we need to do.
Yeah, you can expand into Michigan, Illinois.
What's next is our go-to-market strategy and the scaling up and growth. Okay, so right now I have about 10. This is the entrepreneur hat I'm going to put on. We have 10 to 12 employees that are working every day on our product. But to scale up, we envision literally millions of people using our product every day. That's the vision. Okay, and so it's going to require a beefed up team and a beefed up employee count to make that all happen.
Are your customers individual consumers?
Yes, they are.
Or are your customers potential enterprise?
Yeah, so great question. So as a CEO of the company right now, my job is to, we're focused on the direct to consumer, but I'm bridging relationships in the B2B world to develop the enterprise. We call them pilot projects. So we're identifying some partners in the B2B world that we can pilot some things, create some data, have some proof of case study with them, and then move that forward. So all that kind of happens simultaneously. Right. But the direct consumer now on day one, that's our core.
Right. You want to build that market.
It probably is not going to be our core.
Yeah.
Still a very important part of the company, but it won't be our core in terms of what's bringing revenue into the company.
I wondered a little bit, even if like maybe one of your customers are retired doctors who want to continue providing care.
That's so funny you asked that. I already had one of those doctors reach out to me and say, hey, I hear you doing this. It looks great idea. Can I help?
Yeah.
And the answer I said to him is, thank you for asking. I'll keep that in mind. But the answer is I don't need your help right now because,
not yet.
Marty, I'm I can do all of this scaled up in the system because of how we've created it. Now, I realize I'll have some other, I need a vacation once in a while. Okay.
Sure.
So
Yeah.
I'll have some other doctors involved in
Right.
this with me and so forth. But the initial version is really all
Yeah.
me
Yeah.
carrying because I can.
Right.
Okay.
Right.
So pretty exciting stuff as we grow. Now, I told you, family doctors know what they know and know what they don't know, right?
Yeah.
And so one of the things I recognize, I'm the founder, CEO, CMO, product manager, you wearing a thousand hats, right?
A lot of hats, yeah.
Our first step to really accomplish the go-to-market strategy and partnerships and growth that we see is we're sourcing a new CEO right now to replace me.
Okay.
Because I recognize I have a bit of a ceiling as inexperienced sort of SaaS tech person when it comes to this. I know our space medically, but you bring right team members on who can take the company to the right direction. That's entrepreneurship as well.
Yeah, it's critical.
And so I have a ceiling. I want to bring somebody in that has a much higher ceiling than mine.
Yeah.
And it's going to help our company grow. So again, you talk to me in a year, you'll find there's probably another CEO and lots of team
I want
members.
to talk to you in a year because this is really exciting. So you just started this a year ago, roughly?
I started the journey of the company February of 2024.
So you're a year and a half.
When I say I started the journey on the airplane back from Maui with my wife, dreaming with her about this, she gave me the thumbs up with, you know what, Todd? You've been talking about this for a decade. You're going to retire soon.
Yeah.
I'm saying yes.
Go for it.
And the reason it required her sort of CFO approval is because it's my money that I put in to build this company. This is not built on other people's money at this point.
Well, right. I was going to ask about that because I guess I sort of assumed that you were probably sort of self-financing to some degree at this point, but obviously as you scale, self-financing it, bootstrapping it becomes harder and harder.
You can't do that. It really, again, creates a ceiling in the process. So again, that's part of bringing a CEO on, part of their natural relationships for fundraising and other things that go on. And we're going to break the ceiling that currently exists if we really want this to grow. And Marty, at the heart of this for growth for me is not making a gazillion-dollar business. The heart of growth for me is getting what I know is a great product to as many people in this country as I can.
I am sure your consumers, your customers are going to appreciate that. I mean, I've been the parent there with the sick kid on a Sunday afternoon who I can't get into a clinic, and then you go to the urgent care and you wait for 3 hours in the waiting room with other sick people and a crying child, right? Like, it's a terrible experience.
It is a terrible experience. And the challenge of that is, like in your particular case, if you had a kid that had an earache as an example, you're like, I know my kid's got an earache. They need an antibiotic. This isn't rocket science, right? So why did I have to go through this expensive, long suffering process?
Right.
When you think about the doc in your pocket, that's what we call ChatRx, the doc in your pocket could have solved that problem for you in 5 minutes for $20. You're going to go, sign me up.
Oh, 100%. 100%. Not to mention, you're sitting in a waiting room with other coughing, sick people. I'm 100%. Thinking, geez, now I'm going to get another virus in my house because I spent 3 hours in a waiting room.
So much. You're exactly right. And that's what real people understand that.
Yeah,
they
sure
know
do.
that because guess what? The doctors don't sit in the waiting room.
No.
They're back in the back seeing people when they get put in the exam rooms.
Right.
They don't know what it's like to sit there in that waiting room for 3 hours with all those sick people wondering when it's going to be my turn, and you got a kid that's crying wanting you to help them, and you're like, I'm sorry, buddy, it's going to be okay.
We're just going to
get
wait
you through this. Okay. Like, that's painful. And I have a heart for that and a passion for helping that person.
Yeah, that's great. Well, listen, thank you so much for being on the show. This was, great conversation. I'm excited about what you're doing. I'm excited about all the people that you're going to be able to help with this product. And
thank you.
Good for you for saying, I'm going to retire and do this whole new thing that's going to keep pushing the frontiers of medicine forward, really.
Yeah, so, Marty, I want to thank you for having me on the show, and give me this forum to be able to share my experience and to tell a little bit about ChatRx.md. That's the website you can go to, But again, it's very special for me to be here. I have Northern Indiana roots. I don't need to go to San Francisco. I don't need to go to New York. I can be right here in Marshalltown, Indiana, and do this virtual business, a virtual company that can help change the world for the good and truly be a force for good. And guess what? Any of your listeners out there who are in this region, you can join, not my venture, but even create your own venture and do it right here at home and be homegrown.
There you go.
Okay.
Dr. Stillson, thank you.
You're welcome.